First, I would like to welcome you all. We had 10 weeks of Fulbright experience in Indiana and the CUNY in New York. And first, we went to School of Public Health in Bloomington, and we will go through our program for professional and personal development, culture exchange, home faculty impact on Fulbright, and personal communication. For professional development, our favorite topics were classroom assessment techniques and teaching methodologies, designing and evaluating programs and courses, community engagement, development of student association, marketing and communication, and fundraising for university. I'm Ahmed Wahdan. I'm a consultant of radiology, Suez Canal University Hospital, Ismailia. And I was lucky to have two mentors in my program, Dr. Carrie Doherty, Interim Associate Dean for Community and Global Engagement, and Dr. John Macy, Associate Professor of Applied Health Sciences. And we did a good network between School of Public Health and Environmental Affairs, School of Public Health, Kelly School of Business, and the School of Informatics and Computing with my school in Ismailia. For developing an interactive course in health economics and health administration, and online education portal for health policy education. Also, we are starting a new research for role of higher education in building effective economic policies and strategies for healthcare systems, reformation in developing countries, what's missing and how to develop. And I will leave the floor for Dr. Aya.
Hello, everyone. It's my pleasure to be a Fulbrighter for the Junior Faculty Development Program. I am Ms. Aya Khalil, and this picture was taken in the campus of Indiana University after our first lecture about LinkedIn profile, and most of us use this picture for our LinkedIn profile, and it's a good memory for us from there. I worked with my mentor, Professor Carrie Doherty, and she will be external supervisor for my PhD research project that will be submitted next month. We have both the same interest in ankle instability. Also, we have Public Health Anew. It's public health online courses that will be developed in the Egyptian setting with Indiana University School of Public Health, and my colleague Mahmoud Shaltut from the American University, assistant professor at American University. We are both working on the Public Health Anew. And also, he has with his mentor, Dr. Kan Chow, a research project about the rice. And also, both of us are working with Apley Institute for Park and Public Lands during conducting research project about the importance of the green areas here in Egypt. And now I am leaving the mic for my
Good afternoon, everyone. I am Rania Hussein, consultant of toxicology in the Poison Control Center at Shams University. But first, I will talk on behalf of my colleague, Dr. Sayeda Al-Ghiti. Unfortunately, she couldn't be able to be with us today. Her research of interest mainly with her mentor, Dr. Lu, about using different methods of education in raising the awareness of female students in Alexandria University about cancer breast. Now I'll talk about myself. I have mainly two programs. First program is Program of Substance Abuse Prevention in Egypt in collaboration with Dr. Albert, Research Associate and Education Training Specialist. Substance of abuse in Egypt have sharply increased, especially in the last few years, due to social and economic instability, which may result in many consequences such as increased morbidity and mortality and loss of productivity. So I hope this program will help in prevention of this big problem in Egypt. Second program, which is about carbon monoxide poisoning education, in collaboration with Dr. Brian, Associate Professor in Environmental Department, SCUNY School of Public Health. This also another problem in Egypt about carbon monoxide, which is common in our country, especially in winter months, with accidental poisoning. I hope this program will raise the awareness of Egyptians about this big problem in Egypt. Thank you, and now my colleague Maha El-Ghiti will talk about her professional.
My name is Maha Abdelghani. I'm an assistant professor of microbiology and immunology in Ahram Canadian University. Actually, I was that much lucky to start my research cooperation with Dr. Johanna Liu, Associate Professor of Epidemiology and Biostatistics in breast cancer, weeks before I traveled to US. And when I went there, I added a research cooperation with Dr. Rodrigo Armigis, an associate professor in Department of Environmental and Occupational Health in breast cancer and pollution. We are developing a project on the risk factors for breast cancer. And I was that much lucky to complete on my PhD study on hepatitis C virus with Dr. Cristina Ludima. And one of the most interesting things that I did in Indiana were to attend the Institutional Review Board meetings, which are associated with my study in the Middle East Research Ethics Training Initiative at the University of Maryland, USA. Thank you. I'm leaving the mic to Dr. Mahmoud Zaid.
Mahmoud Zaida, Assistant Lecturer of Food Hygiene and Control, Faculty of Veterinary Medicine, University of Sadat City. My background is veterinary. I'm veterinarian. That's my profession and my passion. And my area of interest and research is food hygiene and control, specifically the food microbiology and foodborne illnesses. I'm concerned with the food hygiene from the farm to fork, and specifically the milk quality from glass to glass, as we say in veterinary medicine. I'll talk about my mentorship in field activities and field experiences with the aid of my mentor, Dr. Justin Otten, the Global Public Health Affairs Director in the School of Public Health. I had a successful connection and engagement with the professional community and the nearby research facilities around the Indiana state and Kentucky state and another states in the United States. The research dairy farm in Kentucky University and many of dairy farms as a professional community around the university. That experience has an impact to empower the experience, to empower the research, the education, and the profession of veterinary medicine. And the most important thing that this experience will open new avenues for collaboration in the same regard, the research, education, and the profession. After we had 8 weeks in Indiana, we moved to DC for the re-entry workshop. The re-entry workshop was about how to exploit our experience we have gained through our stay in the Indiana and in the United States, and to implement back in our countries, and how to find the sufficient and the efficient ways to do that. Our stay in DC, it was only 3 days, but it was a cultural experience as well. We have been in many places, the most famous visiting sites in the DC, like the Congress, the White House, and many of the museums. For the cohort of the public health, it was a unique period in DC because it's a transitional period, not only a re-entry workshop, because unlike the other cohorts, we moved from Indiana and stayed 3 days in Washington, D.C., and we moved to another state, to the New York state, the New York City School of Public Health there. Unlike the other cohorts, they spent a period in their institution. They moved to re-entry workshop, and they went back to their universities I'll hand the microphone to my colleague Ahmed to talk about our experience in New York and our cultural experience and immersion in the United States.
In CUNY University, we had a workshop for population health informatics and learned how to collect and analyze the data and how to use this information for decision making. Also, we were lucky to have host families for each 2 or 3 of us that introduced us to the American culture, and we did a lot, and we had a lot of fun there. Here at the Islamic Center in Bloomington, and in Lake Monroe. And Persuasion, it's a Shakespeare play. We went there. And here in Chicago, and in Washington. And we had tasks to do back home to encourage faculty and students to apply for the Fulbright grant, presenting our Fulbright experience to our colleagues, and participating to promote JFDP program. Thank you. We are done.